My advisor, Dr. Mangulal Agarwal, he specializes in sensor development, and as soon as the pandemic started, we all kind of, especially him, he started to think about developing a sensor for COVID-19, but he wanted to keep all of the researchers safe. So once we figured out all the kinks, we wanted to start working on developing Breathalyzer. We collect the breath in a Tedlar bag, and we collect it through a viral filter though. So all the virus, or 99% of the virus, should be stuck to that viral filter, which they dispose of. Then they put the Tedlar bag in a secondary container that's sanitized heavily with ethanol. And then we bring it back to the lab and treat the surface of the Tedlar bag, not the secondary container, with UV radiation to kill anything on the surface. Then we transfer it to a vial at really cold temperatures over dry ice for the GCMS analysis. My part in that is identifying the volatile chemical biomarkers that the sensors will detect. So I work on recruiting patients, consenting patients, collecting their breath samples. We travel to their house and we have a very safe protocol for protection. And then we take the breath samples back to the lab and we transfer them to a vial. And we perform the solid phase microextraction coupled to gas chromatography, mass spectrometry analysis. That's really my part in the project. For this particular project for COVID-19, we have the Department of Chemistry and Chemical Biology for the analytics and the analytical chemistry. And then we also have mechanical and energy engineering through Dr. Mangulal Agarwal, and that's really important because the synergy of those two departments or those two fields really make this project special, because the analytical chemistry part can identify the biomarkers and the engineers can develop sensors that really target those biomarkers so we can detect COVID-19 with very high accuracy. It is personal to me because I'm lucky enough that my family hasn't been infected, or some of my family has been infected with COVID but haven't had severe symptoms. So I'm really lucky in that manner. But I think for me personally, it's more about getting back to normalcy. That's the main thing, is like our lives have been affected fundamentally and everyone's lives, and I really just would love for people to get back to normalcy, because I really think it's affecting the mental health.